Welcome to another deep dive. Today we're tackling pharmacology. A subject that's absolutely crucial for all of you future nurses out there. We've got a ton of textbooks and research articles here. And I'll be honest, sometimes these can be pretty dense.
Oh, absolutely.
So we're going to break it all down for you, distill it into those must-know concepts, those essential nuggets you'll need for safe and effective nursing practice out there in the real world.
Right. It's all about making this complex information clear, concise, applicable to your clinical experience as a nursing student.
Okay, so let's jump right in with a real-life scenario, something you might actually encounter during your clinical rotations. One of our sources describes a near-miss medication error involving a student nurse. She was about to give a patient an IV med, but caught a discrepancy on the label, like at the very last minute.
Oh, wow.
Yeah, and get this. The IV bag had the right drug and the right dose, but it was labeled for a different patient on the same unit.
Oh, my gosh. That's scary.
Isn't that a scary thought?
Yeah.
That is a truly, truly scary thought.
It really highlights just how important vigilance and attention to detail are in nursing. Even though in this case the pharmacy had made the labeling error, it's ultimately the nurse's responsibility to ensure the right patient receives the right medication. It's a powerful lesson in the legal and ethical responsibilities that come with medication administration.
Really drives home the point that even seemingly small errors can have really significant and really negative consequences.
Absolutely.
So how can nursing students who are just starting out prepare themselves to avoid these types of situations?
Well, a solid foundation in pharmacokinetics is essential. It's basically the study of what the body does to a drug, from the moment it enters the system all the way to its eventual elimination. We often use the acronym ADME to help remember the 4 key processes: absorption, distribution, metabolism, and excretion.
Right, so it's got to be a journey for the drug through the body.
Yeah.
Absorption is how the drug gets into the bloodstream. Distribution is how it travels to different tissues and organs. Metabolism is how the body breaks it down. And excretion is how it's ultimately removed from the body.
Precisely. And, think about this. Each of these steps can be influenced by a variety of factors. Things like a patient's age, their weight, genetics, overall health, even their diet can play a role. This is why understanding those individual patient differences is so crucial in medication administration.
Yeah, that makes a lot of sense. It's not just about memorizing those drug names and dosages from the textbook.
Right.
It's about understanding how those drugs will actually interact with that specific person's body.
Absolutely. And to illustrate this even further, let's consider the concept of ethnopharmacology. This is the study of how different ethnic groups might respond to medications differently based on those genetic variations. For instance, certain populations might metabolize a drug more slowly, which could lead to a higher risk of side effects.
Oh, interesting.
While others might metabolize it more quickly, reducing its effectiveness.
So what might be a safe and effective dose for one patient could be potentially dangerous for another.
That's exactly right.
Wow. That's a lot to consider.
It is, and it really just underscores the importance of considering the whole person, not just the disease or condition you're treating, really looking at that individual.
Right, looking at the whole picture.
Yeah.
Now, speaking of things that can affect how a drug works in the body, our sources also highlight the issue of drug interactions, which can be quite complex.
Oh, absolutely. Drug interactions can indeed be tricky, especially when patients are taking multiple medications, a situation known as polypharmacy.
Right.
Imagine a patient taking 5 different medications, each with its own set of actions and potential side effects. Now, try to picture all the possible ways those drugs could interact with each other. It can get pretty complicated.
Yeah, it sounds like you're trying to solve a really, really complicated puzzle.
Yes.
Some interactions might be beneficial, I assume, but others could be harmful, I imagine.
Exactly. Some drugs might enhance each other's effects, which could be desirable in certain cases, but other drugs might interfere with each other, reducing their effectiveness or even leading to those adverse reactions. And then let's not forget about the risk of drug toxicity.
Right. That's when a drug builds up in the body faster than it can be eliminated.
Right. I would imagine this is especially concerning for patients with impaired liver or kidney function.
You're absolutely right. The liver and kidneys play a crucial role in metabolizing and excreting those drugs. When these organs aren't functioning properly, drugs can accumulate in the system, potentially reaching those toxic levels. This is why close monitoring and dosage adjustments are often necessary for these patients.
So much of nursing is about being that advocate for the patient, being that last line of defense to catch potential errors or problems before they escalate. And that advocacy often involves having the knowledge and confidence to question a medication order if something doesn't seem right. Critically evaluating the situation, considering all those factors at play, and ensuring the patient's safety and well-being are always the top priority.
This is already so insightful, and I'm sure our nursing student listeners are soaking it all in, but we've only just scratched the surface.
So building on those safety considerations we just talked about,
Right.
Let's move on to another area that often causes some anxiety for nursing students, dosage calculations.
Oh, yeah, dosage calculations can definitely feel like a whole other language sometimes with all the formulas and conversions. It definitely takes practice and a good understanding of those basic math principles.
It's true. Accuracy is absolutely crucial when it comes to medication administration. Even a small miscalculation can have serious implications for patient safety. Our sources emphasize, that nurses are legally responsible for the medications they administer, which means we can't afford to be careless with our calculations.
It's a big responsibility. Really highlights how important it is to have a firm grasp of dosage calculations.
And it's not just about plugging numbers into a formula, it's about understanding why certain medications are given in specific doses and forms. For example, why is this medication prescribed as an oral tablet versus an intravenous solution? Or why is a particular drug available in both liquid and capsule forms? These are the types of questions you should be able to answer as you're going through your nursing program.
So it's about connecting the dots between the medication, the dosage form, the route of administration, and the desired therapeutic effect.
Exactly. It's about applying that critical thinking to every medication order that you encounter. Let's say you're given an order to administer 500 milligrams of a medication, but the available tablets are only 250 milligrams each. You need to be able to quickly and accurately determine that the patient needs 2 tablets to receive the prescribed dose.
Sounds like dosage calculation is really an exercise in problem solving, using your knowledge to make sure the patient receives the correct amount of medication.
Precisely. And remember, you have resources available to you. Don't be afraid to consult your drug guides, pharmacology textbooks, or even a pharmacist if you have any doubts. When it comes to medication safety, it's always better to double-check than to make an assumption.
That's a really good point. It's all about working collaboratively and utilizing the resources at your disposal to ensure the best possible outcome for the patient.
Speaking of collaboration, let's transition to the topic of communication in nursing practice. Effective communication is absolutely vital when it comes to medication administration.
Oh, absolutely. Yeah, I'm reminded of that story we discussed earlier about the student nurse who caught a discrepancy in the medication label. She immediately communicated her concerns with her clinical instructor and other nurses, ultimately preventing a potential medication error.
That's an excellent example of how open communication and teamwork can prevent those adverse events. Remember, medication administration is rarely a solo endeavor. You'll be working closely with physicians, pharmacists, other nurses, and of course the patient themselves.
It's like a network of checks and balances, with everyone playing a crucial role in ensuring patient safety.
And communication isn't just about preventing those errors. It's also about understanding the patient's perspective, addressing their concerns, and providing education about their medications.
Empowering the patients to be active participants in their health care. We need to explain things clearly, answer their questions, and make sure they feel comfortable voicing any concerns they may have about their medication.
Absolutely. Effective communication is the cornerstone of patient-centered care. It builds trust, enhances compliance with medication regimens, and ultimately contributes to better health outcomes.
This deep dive is really revealing how interconnected all these different aspects of nursing are. From understanding the science behind medications to mastering dosage calculations to communicating effectively, it's all part of providing safe and compassionate care.
And it really highlights the intellectual and emotional demands of nursing. You need a strong scientific foundation, sharp critical thinking skills, and genuine compassion for your patients.
We've covered so much ground already, but I'm eager to explore the ethical considerations that come into play with medication administration. It's a topic that nursing students often find challenging and thought-provoking. So we've talked about the science behind these medications, the importance of accurate calculations, and the power of effective communication. But, as we all know, nursing is about so much more than just the technical stuff. It's about caring for the whole person. And that includes understanding their individual, beliefs, their values.
That's a really important point you've brought up. Our sources emphasize that a patient's cultural background and their personal beliefs can significantly influence their response to medication and their overall healthcare experience.
Right. Like, for example, some cultures have traditional healing practices that might differ from Western medicine.
Exactly. And, some patients may have religious beliefs that influence their willingness to even accept certain treatments or medications. So it's really our responsibility as nurses to be sensitive to those beliefs and to approach each patient with respect and understanding.
Yeah, sounds like we need to be really careful not to, impose our own values or assumptions on our patients.
Absolutely. Open and honest communication is essential. We need to create a space where patients feel comfortable sharing their perspectives and concerns, without fear of judgment.
It's about building that trust and rapport so we can work together to develop a treatment plan that aligns with the patient's individual needs and preferences.
And a crucial part of that collaborative process is patient education. We need to empower patients to make informed decisions about their health care, and that starts with providing really clear and concise information about their medications.
Yeah, our sources talk about the importance of explaining things like potential side effects, drug interactions, and the proper way to take medications. It's also important to remind patients to, inform their healthcare providers about any over-the-counter medications or herbal supplements they're using. Because, those can also interact with prescribed drugs.
Oh, absolutely. Patients may not even realize that some of those seemingly harmless remedies can have significant interactions with their prescribed medications. And so by educating patients about these potential risks, we're helping them take a more active role in managing their own health.
This deep dive has really driven home the point that pharmacology is so much more than just memorizing drug names and dosages. It's about applying those critical thinking skills, communicating effectively, and approaching each patient with empathy and understanding.
It's a very dynamic and challenging field, but it requires both, intellectual rigor and a genuine passion for caring for others.
Well, for all of you future nurses out there, as you embark on this incredible journey, just remember, each patient encounter is an opportunity to make a real difference. And by combining your scientific knowledge with compassion and a commitment to ethical practice, you can ensure that your patients receive the best possible care. Thanks for joining us for this deep dive into the world of pharmacology. We'll see you next time.